Hello everyone, I welcoming you all in this presentation. I am Ashish Mishra, Assistant Professor in the Department of Pharmacology from Apex Institute of Pharmacy, Samaspur Chunar, Mirzapur. Today I am going to discuss about the topic antidepressant. Basically, when we talk about the antidepressant drug, first we have to know what is depression. So depression, as you all know about this disorder, it is a mental health illness that basically involves the low mood. It is very extreme disorder that approximately affect 300 million people globally, and according to the World Health Organization, this disease holds the most rank position till 2030. That may become a challenging problem for the society because nowadays many persons arise with depression. Basically, the depression is the disease that is characterized by many symptoms like sad mood, loss of interest, pleasure, low energy, worthlessness, guilt, psychomotor retardation or agitation, change in appetite, sleep, as well as suicidal thoughts. In the depressed patient, there are different symptoms that may lead to depression because due to the many factors like social problem, financial problem, these small problems leads to the depressive disorder. In the summarized way, the depressed patient cannot concentrate at their own work and they lack all the interest related to their work. Basically, in accordance with their chemistry, various pathways are responsible for the depression, such as neurotransmitters, mainly serotonin, dopamine, noradrenaline. These neurotransmitters linked with the progression of depressive disorder. But in extreme cases, when this depression is not treated in a limited time, then it may lead to the suicidal behavior and patients may harm himself or herself without any reason. As there are many causes of depression, that is a genetics problem because family history is also responsible for the depressive disorder. There is an imbalance between the chemistry of the brain, poor nutrition, various medications that should not be taken without consultant with the physician, various stress related to the social problem, physical problem, psychological problem, financial problem, insecurity, overdose of drug, various chronic health conditions with chronic diseases that may lead to the depression, inflammatory disorder, brain disorder, thyroid problem, lack of social life, as well as the lack of vitamin D, because Due to the insufficient sunlight, it may leads to the imbalance the uh, chemicals in the brain, and that cause depression. As well as in the human during the pregnancy or post-menopause, pre-menstruation, there is an imbalance between the hormones, and that may lead to the depressive disorder. Now, there are many drugs that treat the depressive disorders, and basically these drugs elevate the mood in the depressive illness. Mechanism behind these antidepressant drugs is to affect the monoaminergic transmission in the brain in one way or the other, and many of them have other associated properties. Many important classifications of antidepressant drugs are categorized as that is, first is monoamino oxidase inhibitor, MAO. First example, phenylazine, tricyclopromine, isocarboxazide, seleglene. Second is tricyclic antidepressant. First is noradrenaline plus serotonin reuptake inhibitor. The drug is imipramine, amitriptyline, trimipramine, doxepine, dothepine, clomipramine. And second is predominantly noradrenaline reuptake inhibitor. The drug is desipramine, nortriptyline, amoxapine, reboxetine. Basically, these categories affect the neuroaminergic transmission in the brain. Third is a selective serotonin reuptake inhibitors like fluoxetine, fluoxamine, paroxetine, sertraline, citalopram, escitalopram. Fourth is atypical antidepressant, trazodone, mianserine, mirtazapine, and other related drugs. Now, when we talk about the monoamino oxidase inhibitor, basically first we have to know what is monoamino oxidase. So, it is a mitochondrial enzyme involved in the oxidative deamination of biogenic amine like adrenaline, noradrenaline, dopamine, serotonin. According to their classification of monoamino oxidase, two types have been identified. That is a MOA and MAOB. MAOA basically deaminates the serotonin and noradrenaline, and this is inhibited by the drug moclobemide. That is a reversible inhibitor of MAO-A. Now, when we talk about the MAO-B, it deaminates the phenylethylamine and dopamine, that basically inhibited by the seleglene, as well as the drugs that selectively block the MAO-B enzyme. When we talk about the dopamine, it is basically degraded equally by both isoenzymes. Now, two types of MAO inhibitors were categorized, that is non-selective and selective. The non-selective MAO inhibitors elevate the mood of depressed patient. The active metabolites of non-selective MAO inhibitors inactivate the enzyme irreversibly. Their effects last for 2 to 3 weeks after discontinuation. Basically, they are the hit and run drugs, and they act irreversibly. As well as these non-selective MAO inhibitors interact with the various drugs, various enzymes, as well as many foods, that is cheese, cold that is a cheese and various drugs such as cold and cough remedies, anti-Parkinson drug, antihistaminic drug, and many categories of drug. Now, this drug demonstrate the mechanism of action of serotonin monoamino oxidase inhibitor. Basically, this enzyme, this inhibitor block the enzyme responsible for the decrease in the neuroaminergic transmission, and after blockage of this enzyme, the inflow of the various amines increase, and that leads to the treatment against depression. Now, the second category of drug is a tricyclic antidepressant. Basically, in this category, both the noradrenaline and reuptake inhibitors are used. Imipramine, it is a basic important drug of this class that have ability to inhibit norepinephrine transporter, that is called NET, and serotonin transporter, that is called SERT, located at neuronal platelet membrane at low and therapeutically attained concentrations. Now, the mechanism of action of these drugs, as I told, it inhibits the active uptake of biogenic amine as well as increasing the concentration in the synaptic cleft in the central and peripheral region. The antidepressant activity of this category developed after weeks. When we talk about the pharmacological actions of tricyclic antidepressant in the different organs of the body, in the central nervous system, the effects differ in normal individuals and the depressed patient. In the normal individuals, it induces a tiredness, sleepiness, difficulty in concentrating and thinking, as well as many other problems like anxiety. But there is no any mood elevation or euphoria, because the patient have no any problem regarding depression. But in the depressed patient, little acute effects are produced. After the 2-3 weeks of continuous treatment in the depressed patient, the mood is gradually elevated. Patients become more communicative, as well as he or she start taking interest in self and surroundings. So basically, in the autonomic nervous system, it have anticholinergic activity, that atropine like effect. They potentiate exogenous and endogenous noradrenaline by blocking uptake, and but also have weak alpha 1 adrenergic blocking action. In the cardiovascular effect, the effects on the cardiovascular functions are prominent, occur at therapeutic concentration, and may be dangerous if taken overdose, like tachycardia, postural hypotension, ECG changes, as well as cardiac arrhythmia. When we talk about the kinetics of drug, that is oral absorption is good. Now the next is selective serotonin reuptake inhibitor. That is basically the major motto of to develop the selective serotonin reuptake inhibitor to overcome the limitations of the conventional tricyclic antidepressants are basically the limitations of TCAs are have an anticholinergic cardiovascular as well as neurological side effect, as well as they have relatively low safety margin, and if taken overdose they may cause a dangerous side effect. But to overcome this shortcomings, a large number of new antidepressant have been developed, and among them are selective serotonin reuptake inhibitor. Basically, it is the first line drugs in depression and allowed their extensive use in the various psychiatric disorders such as anxiety, phobia, OCD and related disorders. In the selective serotonin reuptake inhibitor, basically as name indicate, it blocks the transporter basically involved in the metabolism of the serotonin, that is a SERT, and SERT is an enzyme that is mediates the reuptake of serotonin into the presynaptic terminal, which further leads to the low level of serotonin in the postsynaptic. And the selective serotonin reuptake inhibitor, basically the drug is a fluoxamine. Basically these drugs blocks the reuptake and result in the enhancement of serotonergic neurotransmission. Next is a never inhibitor of noradrenaline and serotonin reuptake inhibitor. Basically these drugs are under the atypical antidepressant. Various drugs like venlafaxine, it is a novel antidepressant, refers to as a SNRI, that is serotonin and noradrenaline reuptake inhibitor, because it inhibits uptake of both these amines. As the trials indicate that the venlafaxine does not produce the usual side effects of tricyclic antidepressant. The nominal side effects are sweating, anxiety, nausea, dizziness, as well as impotence. Next, this diagram represents the mechanism of action of the monoamine receptor. Basically, in this, the drugs block the transporter involved in the metabolism of serotonin and noradrenaline. Next drug is the mirtazapine. This is the most important drug, act as antidepressant that basically blocks the alpha 2 receptor and as well as serotonergic receptor, that is a 5-HT2C. And basically the next is a trazodone. So trazodone, it is the first atypical antidepressant selectively but less efficiently block 5-HT uptake, and these drugs have also prominent alpha blocking activity. When we talk about the use of the atypical antidepressant, it is basically used in the atypical antidepressant and typical antidepressant. It is basically used in the endogenous depression, that is a major depression. The main aim is to relieve the symptoms of depression as well as restore the normal social behavior, as well as it also used in the case of obsessive compulsive and phobic state. In this condition, the selective serotonin are the drugs of choice because of their better patient acceptability. Now, along with this disease, anxiety disorders, neuropathic pain, attention defect hyperactivity disorder in children, as well as the amitriptyline have also some prophylactic value in the patient with migraine. Now, thank you very much for your patience.